Hi, Dr. Yass here. I want to discuss the issue that I think most people are lacking an understanding of when it comes to the idea of strengthening and what is necessary to cause muscles to adapt and get stronger so that they can perform functional activities without eliciting symptoms. And that is the use of progressive resistance exercise. Let's be very, very clear about this. If you're going to any medical practitioner or fitness individual and they simply have you performing a movement which they're describing as an exercise, and you are not performing this quote unquote exercise with some attempt to cause the muscle to adapt to greater and greater resistances, you in effect are wasting your time. So I want to be completely frank about this. Any medical practitioner, physical therapist, chiropractor, exercise physiologist, anybody in the fitness industry, I don't care who it is, if they have you simply going through a motion and you are not applying resistance to a muscle to cause it to adapt and get stronger, you are wasting your time. Let's try to look at this issue from the perspective of the Yass method. The only true method that recognizes that the cause of pain in most cases is the lack of strength of muscles to perform functional activities, meaning that the force output of the muscles is not great enough to deal with the force requirements of the activities that you're performing. So if the force output of the muscles is less than the force requirements of the activities, you strain and elicit pain. Hopefully most people will acknowledge that that's what's going on. Forget anything relating to structural variations. That basically has nothing to do with it. In 95 to 98% of cases of pain, the cause is muscular deficit, based on the principle that the force output of the muscles performing activities are not great enough to perform the activity or have enough force to adapt to the force requirements of the activity and such that the muscles strain and elicit symptoms. So if we were to take that and understand that premise, what would be the only way to see here is the force output of the muscle, here is the force requirement of the activity? How are we going to get the force output from here to here? There's only one way, right? And that is to cause the muscle to get stronger. Hopefully people recognize that. Now, what is the primary mechanism, the only true, pure way of causing muscles to get stronger? That is to cause the muscle to adapt to greater and greater resistances, thereby causing the muscle to create more muscle mass, thereby allowing it to create more force. There is a linear relationship between strength and mass, so if we increase the strength 10%, we increase the mass 10%. It is very well documented that the only true way to make more muscle is to cause the muscle to adapt to greater and greater resistances. So you have pain in your back or your shoulder or your knee or wherever, and you go to somebody, I don't care who it is, some medical practitioner, and they give you a piece of paper and it tells you to kick your knee out or to bend your knee back or to raise your arm or to arch your back or to do any type of calisthenic motion. I am telling you that you are doing nothing to change the primary equation, which expresses the reason why you're having symptoms when you're performing your functional activities, which is that the force output of the muscles is less than the force requirement of the activities. So we have to recognize that we have to incorporate some sort of progressive resistance. Now, typically people will think, oh, if I'm thinking of making muscles stronger, I have to go to a gym and use machines. That's a complete fallacy. The use of any form of resistance, it can be manual, which I'm not a fan of because it's very hard for the person to sustain equal resistance through the range of motion. I'd rather see you use some sort of resistance band or resistance tube, which we could lock into a door or attach to something like a table, anything of that nature, and then we apply the resistance band or tube to the appropriate limb in the appropriate position to allow us to do the exercise correctly. The whole idea being that now you're going to do that movement And the movement should be a single plane motion, meaning that you're only going in one direction. You're not altering, doing multiple directions. You should be very stable when you're doing the exercise, meaning in most cases you should be sitting, and the only joint that should be moving is the joint that the muscle that you're strengthening is putting through range of motion. And then we apply the resistance to allow that muscle to go through that proper range of motion in a stable fashion against a particular resistance. Now, the proper resistance is such that at the 9th or 10th repetition, we always try to use 3 sets of 10 repetitions. At the 9th and 10th repetition, it should feel like it's pretty hard, like you're working pretty hard. Remember, you're not going to get anything for nothing. So if you think you're going to get stronger and it's not going to feel like you're having to put effort in, that would be a bit unreasonable to think. You're going to have to put some effort in. You're going to have to be working. So that 9th and 10th rep should feel like you're working pretty hard. You stay with that resistance until the muscle adapts, gets stronger, and then the 9th and 10th rep becomes fairly easy. That's the point at which you would change your resistance, increase the resistance. Make the resistance such that the 9th and 10th rep are pretty hard again, thereby causing the muscle to adapt to a greater resistance. The muscle eventually adapts. The resistance gets easier. You increase the resistance again. You continue to do this process until you've developed what? Enough strength, force output, that is greater than the force requirement of the activity. What does that lead to? Pain-free, full functional capacity. So, in review, please understand that unless you're applying progressive resistance to the muscles that you're trying to strengthen, and it should be individual exercises performed in a stable fashion, and the exercise is done only in one plane, so you're isolating each individual exercise. That is the only way of ever causing the muscles to get stronger to the point at which they can perform your activity without creating symptom. Without the use of progressive resistance, you're just wasting your time. I don't care who you talk to. I don't care what anyone tells you. The laws of how to develop strength are pure and irrefutable. I can assure you that without applying progressive resistance, your muscles cannot get stronger. So unless you're incorporating that, that is the only way. You are wasting your time. The Yass method is the standard. That is one of the core principles of what makes the Yass method and separates it from all the other things you're seeing out there. It's understanding how to do the exercise. First off, it's understanding that it's muscular, which is one of the core principles that the Yass method allows you to determine. Then you have to establish, if it is muscular, which muscles are involved and leading to the development of symptoms and leading to dysfunction. Then you have to know how to do the proper exercises to isolate the individual muscles you're trying to. And then you have to know how to incorporate progressive resistance. All of this falls into the Yass method. So if you want to really resolve your symptoms in a quick and efficient manner, and you want to get your life back and have the level of function that allows you to do what you want when you want, you need the Yass method. It's that simple. If you want to learn more about the Yass method, you can go to my website at www.mitchellyass.com, MITCHELLYASS.com. Contact me directly. You have a question, you're not sure about what to do, you think this is the right path, but you're not sure, you want to know how to make an appointment or get a Skype evaluation or purchase a book or whatever, just contact me directly at drmitch@mitchellyass.com. That's DRMITCH at MITCHELLYASS.com, or just call me directly on my phone, cell phone, 516-449-1359. That's 516-449-1359. I'm here to answer your questions. I believe that the Yass method is the only true mechanism for diagnosing and treating pain. It's the only one that's going to truly identify muscle as the cause of pain. In 95 to 98% of cases, it is muscle. So without this, more than likely, in more than 90% of cases, you will be misdiagnosed. You will be having treatment applied to a tissue that has nothing to do with what's causing your pain. That's why you can see your friends and family members never getting better, because they're being misdiagnosed and the wrong tissue is being treated. So if you want to get the right information, I'm telling you, this is the method. If you have questions, contact me. I'm more than happy to answer them, guide you in the right direction, and let's see you have your pain resolved. And please get back the life you deserve. The people that I treat, it is so disheartening to see how people's lives can be changed forever due to making a decision through no fault of their own that some medical professional has led them to without any theoretical, clinical, or scientific proper understanding, and that changes people's lives forever. So please get the Yass method. This is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.